Welcome to Know Your Medicine, an initiative by Health9. Eliquis, also known by its generic name Apixaban, is an oral anticoagulant used primarily to prevent blood clots and reduce the risk of stroke. It belongs to a class of medications known as direct oral anticoagulants or novel oral anticoagulants. Why it is used. Eliquis is prescribed for several key purposes: prevention of stroke and systemic embolism in patients who have non-valvular atrial fibrillation, a type of irregular heartbeat that increases the risk of clots forming in the heart and traveling to the brain. Treatment of deep vein thrombosis, DVT, which are clots that typically form in the deep veins of the legs. Treatment of pulmonary embolism, PE, which occurs when a clot travels to the lungs. Prevention of recurrent deep vein thrombosis and pulmonary embolism after initial therapy. How it works. Eliquis works by inhibiting factor Xa, an important enzyme in the coagulation cascade that is responsible for the conversion of prothrombin to thrombin. By blocking factor Xa, Eliquis decreases thrombin production and ultimately prevents fibrin formation, which is essential for clot formation. This mechanism helps to reduce the likelihood of harmful clots forming in the blood vessels. To whom it is prescribed. Eliquis is prescribed to adults with conditions that increase their risk of clotting. It is particularly important for patients with atrial fibrillation not caused by a heart valve problem, as they are at an increased risk of stroke. It is also prescribed to patients who have recently undergone major surgeries such as hip or knee replacements, as they are at higher risk of DVT and PE. Side effects. While effective, Eliquis can also lead to side effects, the most serious being an increased risk of bleeding. Common bleeding-related side effects include bruising more easily, prolonged bleeding from cuts, increased menstrual flow or vaginal bleeding, bleeding from the gums or nose, severe or uncontrollable bleeding. Non-bleeding related side effects might include nausea, allergic reactions, and skin rash. Dosage and consumption. Eliquis dosages vary depending on the condition being treated. For stroke prevention in atrial fibrillation, the typical dose is 5 mg taken orally twice daily. For DVT and PE treatment, the usual dosage is 10 mg taken orally twice daily for the first 7 days, followed by 5 mg twice daily. For the prevention of recurrent DVT and PE, the dose is usually 2.5 mg taken twice daily after completing 6 months of treatment with a higher dose of Eliquis or other anticoagulants. Patients are advised to take Eliquis at the same times every day, with or without food, as directed by their doctor.